Today we're talking with Dr. Esmaré van Walt of Ibervet Pet Clinic in the Strand, and we're going to be talking about two common cat diseases. Dr. van Walt, let's start with feline leukemia. It is a disease that we hear more and more about these days. What exactly is it?
Okay, feline leukemia is a viral disease that's caused by the feline leukemia virus. It is a retrovirus, and it's one of the most common infections that you get in cats, second to trauma. The bad point is that 85% of cats that's infected with feline leukemia will die within 3 years of being diagnosed. The virus affects the immune system, and it causes anemia. They can be more susceptible to cancers like lymphoma. That's also something that happens quite often. The good news is 70% of cats that gets exposed to the virus will resist the infection and they will recover from it.
What are the common symptoms? How would I know if my cat has feline leukemia?
Okay, common symptoms is usually weight loss, not eating well, anorexia, listlessness, anemia, fever, persistent fever, and then often diarrheas as well. So usually a cat that's not doing well, there's usually a rule: if a cat is sick, you do a viral test and check if it's one of the those viruses.
How do you test for it?
We do a in-house snap test. It works a lot like the AIDS test that they do in humans, and the snap test works we can test for feline leukemia and for feline AIDS.
Is it a blood test that you do?
Yeah, you draw a little bit of blood from the vein, like 2 drops. It takes you should wait 10 minutes, and then we get results immediately. Yeah.
Can feline leukemia be cured?
Unfortunately not. Once they've got the virus and they get sick from the virus, there is no medication that you can give them to get them better. The good news is there is a vaccination that you can do to prevent the infection.
Should you vaccinate? I mean, if you're a cat owner, would you advise cat owners to vaccinate against?
I would definitely advise it, because the prevalence here is quite high. I'll give you a little bit of stats later on. So the rule is all kittens can be vaccinated from about 9 weeks of age, and then you repeat the vaccination usually in a month's time. If you have adult cats, I would suggest that they first be tested to make sure that they don't have the virus, and then you can also do the vaccine 2 doses a month apart. And then after that, they usually advise an annual booster just to keep the immunity up. Yeah.
So, say I've been to my vet and my vet says your cat has feline leukemia. What can I as an owner do to make his life more comfortable?
Okay. Usually, make sure your cat's as healthy as possible. So keep up with vaccinations, deworm them regularly, make sure they're on a very good diet. So you want that immune system to be as good as possible. So take it to your vet for regular checkups as well.
Okay, and then another cat disease that I'd like to talk about is Feline Aids. Is it the same as human AIDS?
It is in the same family. It gets caused by human AIDS is caused by the human immunodeficiency virus, and the feline AIDS is feline immunodeficiency virus. But the virus is very species specific, so it would not a cat virus won't affect humans. There's been no records or data that proves that a human can get infected with feline AIDS virus. But it does cause the same symptoms. It also causes the, acquired immunodeficiency syndrome, the same as in humans, and it looks the same. The progression is often the same as well.
How widespread is it in South Africa?
Okay, there isn't a lot of data around. I think there's been studies done in Zimbabwe and in Mozambique, but I've had a look at the tests that we've done here. The last year we've probably done about 115 of those snap tests, and it is less prevalent than the feline leukemia. We had 8 positives of feline leukemia and 6 was positive for feline AIDS in that year that we've tested. There was 1 or 2 cats that had both. You do get that as well.
Now, presumably it's passed on from cat to cat. How does that happen?
Yes, in the feline AIDS one, it's usually when male cats fight. The virus is transmitted in saliva. So that's also why we say it's best to have your cat neutered, that they don't roam around and fight with a positive cat and pick it up like that.
And feline leukemia?
Feline leukemia, yeah, that's a good one. I forgot about that. That's usually transmission between individuals. So the virus is spread in saliva and blood. Both the feline leukemia and the AIDS, the kittens can also get it from the mother, although in feline AIDS it's very rare, but there can be in utero transmission or via infected milk. If the mother is positive, she can transmit it. So for feline leukemia, it's very important. Cats that will be, it's often in multi-cat households because they share fruit bowls, they groom each other, they share litter trays. And yeah, with the feline AIDS, it's more if they fight, you know, so if you have a cat that's outdoors or roams, they can pick it up.
Can I vaccinate my cat against feline AIDS?
Unfortunately, there is no vaccine that was proven to protect your cat.
If I can't vaccinate him, then what can I do to protect him?
Okay, I would say the most important thing is probably if you have a male cat, have it neutered, even the females, because they tend to be very territorial. And so you need to, well, you can't really keep cats indoors, but if you have a positive cat, that's definitely advised. But then also, because it's the same as the feline leukemia, it affects the immune system. You know, keep your cat as healthy as possible. Make sure that they're not exposed to any other cat that might carry the disease.
What about things like medication or food? Are there specifics we should focus on?
I think with foods, it's often just give your cat the best possible diet that you can. You know, just to keep the immune system up. Medications, both these viruses are retroviruses, and with human AIDS, they use antiretrovirals for humans. In cats, unfortunately, it's very expensive and it is quite toxic for cats. There is medication that they call immunomodulators, which is called interferon, and that can often help just to support the immune system. But unfortunately, there is no antiviral, you know, that you can use in both these cases.
Okay. Thank you very much, Dr. van der Walt. That was great.